Tell me about yourself and why you decided to become a certified nursing assistant.
My journey into healthcare began not in a classroom, but at home, helping to care for my grandmother as she aged. That experience was my first real understanding of the profound impact that compassionate, hands-on care has on a person's dignity and well-being. I saw how something as simple as a gentle touch during a bath or patiently listening to a story could transform her entire day. It was this realization that solidified my decision to become a certified nursing assistant. I wanted to provide that same level of comfort and respect to others during their most vulnerable moments. I am a naturally empathetic and patient person, and I knew I needed a career that would allow me to use those traits in a tangible, meaningful way. The CNA role is the very heart of patient care. It's where clinical skill meets human connection. I completed my certification at a Name of Institute, where I excelled in both the theoretical knowledge and the practical clinical rotations. I truly value the privilege of being able to assist individuals with their most personal needs, from bathing and dressing to ensuring their mobility and comfort. For me, this work is more than a job, it is a calling. It is about being a trusted presence, a careful observer who can report critical changes to the nursing team, and most importantly, an advocate who ensures every patient feels seen, heard, and valued. I am eager to bring my dedication, my strong work ethic, and my genuine passion for helping others to a professional healthcare team where I can contribute to providing exceptional, patient-centered care every single day.
What are the most important responsibilities of a CNA?
While the core of the CNA role is undoubtedly hands-on care, I believe the most important responsibilities are those that blend technical skill with profound human connection, ultimately upholding the patient's safety, dignity, and overall well-being. Fundamentally, we are the primary caregivers assisting patients with their activities of daily living, which includes bathing, dressing, toileting, and feeding. However, performing these tasks is not just about checking a box. It is about preserving the individual's autonomy and self-esteem during vulnerable moments. This requires immense patience, respect, and compassion. Beyond ADLs, our responsibility as the consistent presence at the bedside makes us critical observers. We are the eyes and ears of the nursing team. This means meticulously measuring and documenting vital signs, but more importantly, it means being attuned to subtle changes, a slight confusion in a normally alert patient, a change in skin condition, or a difference in appetite. Recognizing and immediately reporting these nuances to the nurse is a vital responsibility that can directly impact patient outcomes and prevent complications. Furthermore, ensuring patient safety is a non-negotiable duty woven into every interaction. This encompasses everything from using proper body mechanics and assistive devices during transfers to prevent falls, to strictly adhering to infection control protocols. Finally, I see providing emotional support and companionship as an equally essential responsibility. We often spend the most time with patients, offering a listening ear, a reassuring word, or simply a calming presence. This holistic approach, tending to the physical, emotional, and psychological needs of the patient, is what truly defines the most important work of a certified nursing assistant.
Describe your experience with activities of daily living.
My experience with activities of daily living has truly taught me that these are the moments where care meets compassion in its purest form. I found that the routine of ADLs is where you build the strongest rapport with patients and have the greatest impact on their sense of dignity. For instance, during my clinical rotation at a skilled nursing facility, I was assigned to care for Mr. Davies, an elderly gentleman recovering from a stroke who had significant weakness on his right side. My task was to assist him with his complete morning routine, which included grooming, dressing, and breakfast. The action I took was always to prioritize his participation and choice. I would set up his toiletries within reach on his left side and encourage him to brush his teeth or wash his face himself, offering steadying support. When dressing, I would use adaptive techniques, such as a dressing stick, and patiently guide him through the process, allowing him to do as much as possible. I made sure to always close the curtain fully, explain each step before I did it, and maintain a conversation to make it a shared human experience rather than just a clinical task. The result was that over just a few weeks, Mr. Davies became more confident, and his mood visibly improved each morning. He went from being passive and withdrawn to actively engaging in his own care. This experience solidified for me that assisting with ADLs is not just about completing a list of tasks, It is a fundamental nursing function that preserves independence, monitors for physical or cognitive changes, and affirms the patient's humanity every single day.
How do you measure and record a patient's vital signs accurately?
Measuring and recording vital signs accurately is a critical responsibility, as this data forms the baseline for clinical decision-making. My process is always systematic and patient-focused. Before even beginning, I ensure all equipment is clean, calibrated, and functioning properly. I greet the patient warmly, explain the procedure to gain their cooperation, and make sure they are in a comfortable and rested position, as activity or stress can skew the results. I typically follow a sequence to ensure efficiency and comfort. For instance, I might begin by palpating the radial pulse for a full 60 seconds to get an accurate rate and rhythm. Then I would discreetly count the respirations for another 60 seconds while my hand is still in position, so the patient is not aware and doesn't consciously alter their breathing. For blood pressure, I ensure the cuff is the correct size and placed on a bare upper arm at heart level, with the patient quiet and their feet flat on the floor. I use a manual sphygmomanometer for precision, noting the systolic and diastolic sounds clearly. Temperature is taken using the facility's preferred device, whether tympanic, temporal, or oral, always following the manufacturer's guidelines for correct placement. The process does not end with collection. Accurate recording is equally vital. I immediately document the readings in the patient's chart or electronic health record with exact time and date. I am also trained to be vigilant about the entire clinical picture. I don't just record numbers. I observe and note anything relevant, such as the patient's level of pain, skin color, or if they were anxious during the reading. Most importantly, I understand my role as a frontline observer. If any vital sign is outside the normal range, or if there is a significant change from a previous reading, I report it immediately to the nurse in charge without delay. This ensures that accurate data leads to timely and appropriate intervention.
What is the proper procedure for transferring a patient from a bed to a wheelchair?
The proper procedure for transferring a patient is a carefully choreographed sequence focused entirely on safety for both the patient and the caregiver. Before I even approach the patient, I would perform a quick safety assessment, considering the patient's mobility level, strength, and cognitive state, and I would always plan to have a second staff member assist if there is any doubt about my ability to manage the transfer safely. My first action is to prepare the environment. I would bring the wheelchair to the bedside, lock both brakes, and ensure the footrests are swung out of the way. I would then lower the bed to its lowest position and lock the bed brakes as well. Next, I would explain each step of the process to the patient to ensure they are cooperative and understand how to assist. Using a gait belt is a non-negotiable standard for me, as it provides a secure hold. I would help the patient sit up on the edge of the bed, the dangling position, and allow them to sit for a moment to ensure they are not dizzy. I would place their feet firmly on the floor and position my own feet in a wide, stable stance with one foot forward. With the gait belt secured, I would position myself directly in front of the patient, bending at my knees and hips, not my waist, to maintain proper body mechanics. On the count of 3, I would use the strength of my legs to rock the patient up to a standing position, allowing them to steady themselves for a moment. Then I would pivot my feet so the patient's back is towards the wheelchair and guide them gently back into the seat. Finally, I would ensure they are positioned comfortably, place their feet on the footrests, and secure any safety straps if required. The result of this disciplined approach is a secure and dignified transfer that minimizes the risk of falls for the patient and prevents debilitating back injuries for me, ensuring we are both safe.
A patient under your care falls. What is the first thing you would do?
The first thing I would do if a patient falls is to stay calm and immediately ensure the area around a patient is safe from further hazards. My very first action would be to verbally reassure the patient, speaking to them in a calm voice without moving them. I would say, "It's okay, I'm here with you. Don't try to move." I would then quickly assess their level of consciousness by asking them simple questions like, "Can you tell me your name? And can you tell me where you are?" Simultaneously, I would look for any obvious signs of injury, such as bleeding, deformity, or if they are complaining of pain in a specific area. Crucially, I would not attempt to move the patient, as this could exacerbate an unseen spinal or orthopedic injury. My next immediate step would be to call for help. I would use the nurse call button or shout for a colleague to immediately alert the registered nurse on duty while stating clearly that a patient has fallen. I would stay with the patient, continuing to provide reassurance and monitoring their vital signs and condition until the RN arrives. Once the nurse is present and takes charge of the clinical assessment, I would assist as directed. After the situation is stabilized, I would meticulously complete the facility's incident report, providing a factual, detailed account of what I observed before, during, and after the fall. My priority is a swift but careful response that prioritizes the patient's medical well-being above all else.
How would you handle a difficult, confused, or agitated patient who refuses to take a bath?
Handling a situation with a confused or agitated patient requires me to first shift my focus from the task of bathing to the person and their emotional state. My immediate response would be to remain completely calm, use a soft and reassuring tone, and ensure my body language is non-threatening. I would never argue or try to force the issue, as that only escalates fear and resistance. Instead, I would approach the situation with empathy, seeking to understand the root of their refusal. I might say something like, "I can see this is upsetting for you. That's okay. We don't have to do anything you're uncomfortable with. Can you tell me what's worrying you?" Often, the refusal is rooted in fear, confusion, or a loss of control. My next step would be to offer choices and alternatives to empower the patient. I might suggest, would a sponge bath in bed feel more comfortable than the shower today? Or how about we just wash your face and hands for now? Sometimes simply postponing the task for 15 minutes can make a world of difference, allowing the patient to calm down and feel more in control. If the patient remains consistently agitated, or if their behavior is a significant change from their baseline, I recognize this as a crucial clinical observation. I would respectfully disengage from the task, ensure their immediate safety, and report the incident in detail to the supervising nurse. The refusal is not a personal failure, but potentially a symptom. It is my responsibility to communicate this effectively so the nursing team can assess underlying causes like an infection, pain, or a medication side effect, ensuring the patient receives the comprehensive care they need.
You notice a change in a patient's condition, e.g., they are more short of breath or disoriented. What do you do?
When I notice a change in a patient's condition, my response is immediate and systematic, guided by the principle that even a subtle change can be an early warning sign of a serious issue. For example, if I were to find a patient who is normally alert suddenly becoming disoriented, my first action would be to approach them calmly and perform a quick, focused assessment. I would check their level of consciousness using their name and simple questions, note their respiratory effort and skin color, and take their vital signs if the situation allows and I have the equipment at hand. However, my most critical responsibility in this scenario is not to diagnose, but to report. I would immediately seek out the supervising nurse and provide a clear, concise report of my observations. I would use a structured communication method stating the situation. "I'm concerned about Mr. Jones in room 204. I would then provide the background. He was alert and oriented an hour ago during my last round. Next, I would give my specific assessment. He is now confused about where he is, his speech is slightly slurred, and his pulse is rapid at 110. Finally, I would state what I believe is needed. The result of this process is that the nurse receives timely, specific, and actionable information, enabling them to perform a deeper clinical assessment and intervene rapidly. I would then carefully document my findings and the time I reported them, and I would continue to monitor the patient closely as directed, understanding that my vigilant observation is a fundamental link in the chain of patient safety.
Describe a time you provided emotional support to a patient or their family.
I was caring for an elderly gentleman, Mr. Henderson, who was recovering from hip surgery. His wife of over 50 years, Mrs. Henderson, was his primary support and was always by his side. One afternoon, I entered the room to find her quietly crying in the chair by the window while Mr. Henderson was asleep. She was overwhelmed and exhausted, worried that she wouldn't be able to care for him once he was discharged. My immediate task was to assist with Mr. Henderson's vitals, but it was clear that the most pressing need was to support his wife. I recognized that her emotional well-being was directly connected to the patient support system, and my role was to offer her comfort and reassurance in that moment of distress. I finished my clinical tasks quietly so as not to wake her husband. Then I pulled up a chair beside her, offered her a tissue, and simply said, "This must be so hard for you. Would you like to talk about it?" I didn't offer empty platitudes. I just listened actively as she shared her fears about their future, her feeling of helplessness, and her fatigue. I validated her feelings, saying it was completely understandable to feel that way. I then provided some concrete reassurance, explaining the discharge planning process, and that the team would ensure they had the resources and training they needed before going home. I also made her a cup of tea and emphasized that it was important for her to take moments for herself, even if just to step outside for a few minutes, assuring her we would watch her husband closely. Mrs. Henderson visibly relaxed. She thanked me profusely for listening and said she felt a heavy weight had been lifted just by talking it through. After that, she became a more engaged and confident partner in her husband's care, asking more informed questions. That experience reinforced to me that emotional support isn't a separate task from clinical care. It is an integral part of it. By taking 10 minutes to truly see and listen to a family member, I was able to alleviate her burden and, in doing so, created a better support system for my patient.
You see a colleague treating a patient roughly or speaking to them disrespectfully. How would you handle this?
Witnessing a colleague act in a way that compromises a patient's dignity is a serious situation, and my response would be guided by my primary duty as a patient advocate. My first priority would be to ensure the immediate safety and well-being of the patient. If it is safe to do so, I would intervene directly in a non-confrontational manner. I might approach and say something like, "It looks like you might be having a challenging moment. Can I help you with this care? Or let me give you a hand so we can finish up." The goal in that immediate moment is to de-escalate the situation, provide a witness, and redirect the interaction toward a more respectful and safe standard of care. However, my responsibility would not end there. Regardless of the immediate outcome, I have an ethical and professional obligation to report the incident. I would discreetly document exactly what I saw and heard, noting the time, date, individuals involved, and the specific nature of the behavior. I would then report this information directly to the nurse in charge or the unit supervisor as outlined in the facility's protocol. I understand that reporting a colleague is difficult, but patient safety and dignity are non-negotiable. Such behavior can indicate burnout in a colleague, but more importantly, it represents a potential risk to patient well-being that the management must be aware of to address appropriately, whether through remedial training, support, or disciplinary action. My ultimate loyalty lies with maintaining a safe and compassionate environment for the vulnerable individuals under our care.
How do you prioritize your tasks when you have multiple patients with different needs?
Prioritizing tasks as a CNA requires a dynamic and constantly evolving strategy, where I must balance scheduled duties with emergent patient needs. My approach is always to triage based on a combination of clinical acuity, patient safety, and established schedules. At the start of any shift, I create a mental map of my patients, noting their specific care plans, meal times, and any scheduled procedures. However, I treat this plan as a guide, not a rigid schedule, knowing that a patient's condition can change in an instant. In practice, this means I categorize tasks in real time. Urgent and time-sensitive needs always come first. A call light for toileting, for example, is a top priority because it directly impacts patient dignity and fall prevention. Similarly, any sign of acute distress, a change in condition, or a request for pain medication from a patient would prompt me to stop my current task and immediately assess and report. Alongside these urgent needs, I'm constantly working to complete scheduled tasks, such as vital sign rounds and meal assistance, in their designated windows. I have found that clustering care is highly effective. When I am in a patient's room to take vitals, I also ensure their water is filled, their call light is within reach, and I ask if they need anything else before I leave. Crucially, I maintain open and constant communication with a nursing team. If I become overwhelmed or see a conflict in priorities emerging, I do not hesitate to verbally check in with the charge nurse to ensure we are aligning our efforts for the safety and well-being of all our patients. This flexible, patient-centered system allows me to provide thorough and responsive care even during the busiest shifts.
What do you feel is the most challenging part of being a CNA?
For me, the most challenging part of being a CNA is not the physical demands or the fast pace, but the emotional weight of the role. We are granted the privilege of entering people's lives during their most vulnerable moments, and forming these close bonds means we also share in their struggles. The profound challenge is maintaining a compassionate and professional equilibrium when faced with patient decline, difficult family dynamics, or the grief that accompanies end-of-life care. It can be emotionally draining to provide constant comfort and support while managing your own human emotions. However, I have learned to see this not as a burden, but as a responsibility that requires intentional self-management. I've developed strategies to ensure I can consistently show up for my patients without succumbing to burnout. I practice mindfulness and make a conscious effort to focus on the small, significant victories, a patient's smile, a word of thanks, or a moment of genuine connection. These are the moments that replenish my spirit. Furthermore, I rely heavily on the support of my colleagues. We debrief after difficult shifts and check in on each other, creating a strong team foundation. By maintaining a healthy work-life balance through activities like walking and reading, I ensure I have the emotional capacity to give my best. Ultimately, I found that navigating this emotional challenge is what makes the work so deeply meaningful, and it reinforces my commitment to providing dignified care every day.
How would you describe your communication style with nurses and other healthcare team members?
I would describe my communication style as clear, concise, and collaborative, with a strong emphasis on respect for the roles and expertise of every team member. I understand that in a fast-paced clinical environment, effective communication is a critical component of patient safety. My primary goal is to ensure that the information I convey is factual, timely, and actionable. To achieve this, I actively utilize structured tools like SBAR, situation, background, assessment, recommendation, especially when reporting a change in a patient's condition or during handoffs. For instance, instead of saying, "Mr. Evans doesn't seem right," I would say situation. "I'm calling about Mr. Evans in room 302 who has become increasingly confused over the past hour." Background: he was alert and oriented at the start of the shift. Assessment: his vital signs are stable, but he's unable to recall his name or the year. Recommendation: I think he needs your immediate assessment. This method ensures that no critical detail is missed and that the nurse receives a complete clinical picture. Beyond formal reporting, I believe in the importance of proactive and respectful daily interaction. I make a point to actively listen during team huddles, ask for clarification when I am uncertain about a care plan, and provide timely updates on the completion of my tasks, such as reporting that a patient's intake and output have been documented. I see myself as a key link in the communication chain, and my style is fundamentally rooted in the understanding that we all share the same ultimate goal: providing the safest and most effective care for our patients.
How do you maintain a positive attitude in a stressful work environment?
Maintaining a positive attitude in a demanding environment is less about constant cheerfulness and more about cultivating resilience and finding genuine meaning in the work. I've learned that my positivity is a renewable resource, not a finite one, and I manage it through a few key practices. Fundamentally, I anchor myself in the why behind my work, the patients. Focusing on the small human moments of connection, like a patient sincerely thanking me for my patience or seeing their relief after I've made them comfortable, instantly recharges my sense of purpose. These interactions are powerful reminders of the difference we make, even on the most chaotic days. On a practical level, I am a strong believer in the power of teamwork and microbreaks. I make a conscious effort to be a supportive colleague, and that positivity is often reciprocated. A quick, encouraging word with a coworker can lift the entire team's spirit. If I feel stress building, I learned that even a 30-second pause to take a few deep breaths at the nursing station or while washing my hands can help me reset and refocus. Finally, I am very intentional about creating a boundary between work and home. I use my commute to decompress, and once I am home, I engage in activities that refresh me, like spending time with family or going for a walk. This allows me to consistently return to my next shift feeling replenished and ready to provide the compassionate, positive care that my patients deserve.
How do you ensure patient confidentiality and privacy?
Ensuring patient confidentiality and privacy is a fundamental ethical commitment that I integrate into every aspect of my work, from physical actions to digital and conversational vigilance. I view it as protecting the patient's personal sphere and upholding their right to dignity. On a practical level, this begins with simple, consistent actions. I always knock and wait for acknowledgement before entering a room, and I immediately close the curtain or door fully during any personal care, such as bathing or toileting. I am meticulous with physical records, ensuring charts are never left unattended at a nursing station and are stored securely. Beyond the physical space, I'm extremely mindful of information security. I never discuss patient information in public areas like hallways, the cafeteria, or elevators. Conversations with nurses or other team members about a patient's condition are held discreetly at the nurse's station or in a private room. I strictly adhere to all policies regarding electronic health records, ensuring I never share my login credentials and always log out of a computer terminal immediately after use. I understand that confidentiality extends beyond the workplace, meaning I would never discuss a patient's details with family or friends or on any social media platform. For me, this is non-negotiable. It is the bedrock of the trust our patients place in us, and I see it as my duty to honor that trust in every action, large and small.
Where do you see yourself in the next 3 to 5 years?
In the next 3 to 5 years, my primary goal is to solidify my foundation as an exceptional and highly competent certified nursing assistant. I am deeply committed to mastering the intricacies of this vital role, becoming a reliable and invaluable member of the healthcare team right here. I aim to be the CNA that both nurses trust implicitly and patients remember for their compassionate and thorough care. I see myself expanding my skills, perhaps by seeking certifications in specialized areas like phlebotomy or dementia care, to contribute even more effectively to this organization. Looking further ahead, I am very passionate about a long-term career in patient care, and I do have aspirations to advance my education. The hands-on experience and clinical insight I gain as a CNA will be the perfect groundwork for pursuing a degree as a licensed practical nurse or registered nurse in the future. I am particularly drawn to the philosophy and standard of care at this facility, and I believe there is no better environment in which to learn and grow. My plan is to build a stable and impactful career here, using my experience as a CNA as the cornerstone for my future professional development, all while continuing to provide the high-quality, hands-on care that is the heart of what we do.
What does patient-centered care mean to you?
To me, patient-centered care is the fundamental philosophy that shifts the focus from simply completing a list of clinical tasks to truly caring for the whole person entrusted to us. It means that when I enter a patient's room, I'm not just seeing a diagnosis or a set of needs to be met. I'm engaging with a unique individual with their own life story, values, fears, and preferences. It is built on a foundation of mutual respect and dignity. For example, it's the difference between mechanically performing the task of giving a bed bath and taking the time to ask if the patient prefers a certain soap temperature, or to involve them by allowing them to wash their own face, thereby preserving their autonomy. This approach informs every interaction. It means I actively listen to their concerns, explain what I am about to do and why, and honor their choices whenever possible, even if it's as simple as choosing what to wear for the day. It's about recognizing that a patient is more than a body in a bed. They are a person whose emotional and psychological well-being is just as important as their physical health. Ultimately, patient-centered care is a partnership. It is my professional and ethical duty to not only ensure their safety and comfort, but to empower them, advocate for them, and see them as a collaborative partner in their own healing journey, thereby providing care that is both clinically excellent and profoundly human.
Why do you want to work at this facility specifically?
My desire to work at this facility specifically is driven by a deep alignment between your organization's published values and my own professional philosophy. While researching, I was particularly impressed by your explicit commitment to the Plaintree model of person-centered care and your focus on creating a healing environment that addresses the emotional and spiritual needs of patients, not just their clinical conditions. This holistic approach resonates perfectly with my belief that care should be a partnership with a patient and their family. Furthermore, I followed the reputation of your cardiac rehabilitation program, which is consistently recognized for its outstanding patient outcomes and innovative care protocols. The opportunity to work alongside a multidisciplinary team that sets such a high standard is incredibly motivating for me as a CNA. I am not just looking for a job. I am seeking a professional home where I can contribute to a team that leads by example and where the culture actively supports both its patients and its staff. I am confident that my dedication to compassionate, detail-oriented care would allow me to thrive here and become a valuable contributor to your esteemed team.
How do you handle feedback or criticism from a supervisor?
I genuinely welcome and value feedback from my supervisors, as I see it as an essential tool for my professional growth and for ensuring the highest standard of patient care. My approach is to receive it with active listening, and a positive mindset. For instance, if a nurse supervisor were to pull me aside and suggest that I could improve my documentation by being more specific about a patient's intake, my immediate reaction would not be defensiveness. Instead, I would listen carefully without interruption, ensuring I fully understand the perspective. I would then ask for clarification if needed, such as "Thank you for pointing that out. Could you give me an example of the level of detail that would be most helpful for the team?" I believe that the true value of feedback lies in the action that follows. After such a conversation, I would make a conscious and immediate effort to implement the suggestion. In this case, I would meticulously detail the specific amounts and types of fluids consumed in my next charting entry. I view constructive criticism not as a personal critique, but as a targeted opportunity to refine my skills and become a more competent and reliable member of the healthcare team. This process of continuous improvement, guided by the experienced eyes of my supervisors, is how I strive to provide the safest and most effective care possible for my patients.
Do you have any questions for us?
Yes, thank you. I do have a few questions. First, having read about your facility's strong commitment to person-centered care, I'm very interested to know what that looks like in the daily routine for the nursing team. Could you share an example of how that philosophy is put into practice in this unit? Secondly, could you tell me more about the support structure for CNAs here? I'm curious about what a typical orientation and mentorship process looks like for a new hire, and what opportunities exist for continued education or specialization, such as in dementia care or phlebotomy. Finally, thinking about the team's success, what would you say is the most important quality that makes a CNA truly excel in this specific environment? Your insight would be invaluable as I consider how I can best contribute to your team and the patients you serve.